My name is Jennifer Greer, and I want to welcome you to our noon Zoom, Reproductive Health on the Ballot. I'm with a group called Mad Make a Difference, a local citizen activist group based in Birmingham. My co-chair is Shannon Haddock, who's been helping us on tech this morning, and we'll be running the chat room. We'll have a good many links to put in because this is going to be an information-rich session. We are co-hosting this session with Kristen Resnick and Megan Cheek of Hive, Alabama, a super awesome citizens activist group based in Homewood. I may be biased, but I think the conversation that we are about to have about reproductive health may be the most important one we have on a single issue before November 5th. And I say that we do not have, obviously, we will not be voting on a ballot issue regarding reproductive health like they will be in 10 other states. But arguably, Alabama is ground zero for the fight for reproductive health. And I say that because over the last 2 years, I think we have seen our historically underfunded and failing public health system collide with bad decisions from the Alabama court system and also with the national Dobbs crisis, and creating somewhat of a kind of a perfect storm in healthcare dysfunction here that puts in jeopardy a range of care from contraception, abortion care, miscarriage care, to IVF, labor and delivery, and midwifery care. Just a range of types of health care that are now problematic are up in question for us today in Alabama. So the good news is, and please mute yourself. Please, Lindsay Wyndham, please mute yourself if you're listening.
I'm so sorry.
Yeah, that's all right. We're recording this session, and you probably don't want your personal conversation on that recording.
No.
Yeah. Okay. Thank you. So in any event, the good news is Alabamians are fighting back. We are not taking this lightly. We are fighting back, and we have 8 awesome warriors in the fight today with us today. And we have healthcare professionals, legal advocates, political leaders, activists, and we will go to probably 1:15 today, a little longer than normal. And we are recording, as I indicated. I think when we are done, you will agree that this is not a women's issue. This is a democracy issue, and that we all need to be in the fight if we're gonna win this issue. So we're gonna start with Dahlia Abrams, co-founder and executive director of Birthwell Partners. Executive director of program operations for Birthwell Partners Community Doula Project. And Dahlia is a DONA certified birth doula, a Lamaze certified childbirth educator, a certified lactation counselor, a DONA approved birth trainer. She earned a master's degree in public health from UAB with a focus on maternal and child health. She is also a wife and a mother of 4 amazing grown children. So anyways, Dahlia, are you on? Can you unmute?
I am here. Thank you so much for that, Jennifer.
Great.
So, first of all, I have to say that I am the former program director or executive director of program operations at Birthwell Partners. I saw that Susan Petrus is on here. She's the director now. So I have stepped down from that role, and very excited for the new people that are working there and the increased diversity of our staff, and just super thrilled about that. So I've kind of moved on from that to looking for opportunities to run my mouth on this topic. So I really appreciate Jennifer giving me the opportunity.
That's great. And can you just start with and you may be going to do this anyways, but explain to us what a doula is and what role in particular Birthwell Partners plays in reproductive health care in Alabama.
Absolutely. So a doula is a non-medical birth support professional, actually pregnancy, labor, birth, and postpartum support professional. So they're not nurses, they're not midwives, As doulas, we provide emotional support and we help people find the information that they need to advocate for themselves to have the healthiest and safest birth the way they define that. Birthwell Partners was founded by Susan Petrus and myself in 2011 to make doula support available to anyone who wants it, regardless of their ability to pay. So there is a large body of research that shows that having a doula support you through pregnancy and birth has really important impact on health outcomes for the birth giver and for the baby. But it's something that's not covered by insurance or by Medicaid. So it's only available to people who have the funds to pay for it out of pocket. So Susan and I started the program in 2011, like I said, to provide free doula services for people on Medicaid. And the other part of the mission of Birthwell Partners was to build a doula workforce across the state so that there would be doulas of all different socioeconomic statuses, different racial and ethnic identities providing this service for people so people could get care from someone who looks like them and has a shared life experience.
Wonderful, wonderful. Now, so you've been a doula longer than 10 years. I think you said 2012 was when you founded Birthwell. So tell us, can you describe a little bit about the role that Birthwell may have played in promoting healthy birthing in the state, and then what some of your concerns are? What are you seeing in the landscape and hearing from your patients? Are your concerns about the state of the care here today?
So over the time that Birthwell's been functioning, we've been advocating for doula support for people throughout the state and all of that time, and it's really risen up and been something that people are talking about now. So when we started, most people didn't know what a doula was, and now because of work we've done, and also nationally, it's just come onto the scene. People are aware of doulas. People who everyone recognizes. Of course, I can't think of any of the people who have talked about their doula on social media and that kind of stuff. But it's really become something that people are much more aware of. And people are looking nationwide to doula support as one of the ways of addressing our serious maternal mortality crisis and infant mortality crisis in the United States. And doulas absolutely can play a role in helping people to advocate for themselves better and helping their voices be heard. And here, Jennifer, I'm just going to go off on my little soapbox here. I think one of our biggest problems in healthcare is the lack of a system and of training the people who work in the system to really listen to the people that they're serving. We know that patient-centered care and shared decision-making is critical for good healthcare outcomes. And doulas help people to get that kind of care by helping raise up their voices and helping them figure out what they need to be asking for, what questions they have. And in Alabama, instead of increasing the power of people who are getting medical care, we're actually decreasing their power. So that's really where we need to be focused, is what can we do to make sure that women's voices are heard, that people who have the capacity to be pregnant, that their voices are heard, and that they have a way of speaking up and getting the care that they need instead of reducing that, which is what's happening right now.
And I don't know if you mentioned this, but I do remember from some volunteer work that I've done for you that there are specific tangible outcomes for working with doulas, higher birth weight babies, fewer cesarean sections, and so tangible health outcomes, and those are the directions that we need to be moving in.
Absolutely. So we have this high maternal mortality ratio, and one of the things that leads to that is doing too many C-sections. And it's well recognized that we do probably 2 or 3 times more C-sections than we should be doing. Alabama is, of course, at the top of the list with about 35%. So
wow.
More than 1 in 3 people will have a C-section. And we know that when you have a doula, it reduces that. And we have data from Birthwell Partners from over 750 births that our doulas have attended that our C-section rates are in the 20 percentile, 20 to 25% instead of 30 to 35%. So that makes a big difference. I do want to call out Dr. Skanes, who's on here, and the work she's doing with birth centers, because that's really another one of the important solutions to improving outcomes. But yes, doula supported birth. People have lower risk of having a preterm birth, of having a low birth weight baby, both things that lead directly into infant mortality in the first year. Lower chances of having a C-section, which is major surgery, which increases your risk of infection and all those kinds of things. But also, one of our big problems with maternal mortality is the racism that's baked into our maternity care system. So we need to look at racism in two ways. We need to look at racism in the system, in the structural system of how we do things. And we also need to look at the racism that happens on a day-to-day basis. So, and this actually brings me not just to the maternal mortality rate, but to really stark disparities between outcomes for people who are people of color, Black people compared to white people. They're much higher risk of death, of morbidities, and for their baby as well. And so those things can be addressed. They have to be addressed in a systemic level. Doulas are able to help with that on a very interpersonal level and kind of mitigating some of that implicit bias that's happening day to day, moment to moment in the birthing space.
Dahlia, thank you so much. Appreciate you. We're going to move on to Dr. Skanes. As Dahlia suggested, Dr. Heather Skanes, OBGYN, is founder of Oasis Women's Health and Family Birthing Center. And let me tell you a little bit about Dr. Skanes. Dr. Skanes earned her bachelor degree in African and African American Studies from Washington University in St. Louis, Missouri. She studied maternal and child health at the University of Alabama for 1 year before working toward her medical degree at Wright State Boonshaw School of Medicine in Dayton, Ohio. She completed her residency in obstetrics and gynecology at Morehouse School of Medicine in Atlanta, Georgia. And she founded Oasis Family Birthing Center in 2022 and sits on the board of the American Association of Birth Centers, which provides the professional standards and I guess oversight for birthing centers. Dr. Skanes, are you on here today?
Yes, I am here.
Great, welcome. So glad to have you. Birthing centers are relatively new, and I'm so excited about them. So can you tell us what birthing centers do and kind of explain the midwifery model that you use?
Yes. So I would say one, creating the narrative or reminding people of the fact that people gave birth outside of the hospital for the majority of human history. So they're not really being outside of the hospital to give birth. It's not really new, but we're bringing it back to Alabama. And birthing centers are a home-like environment to give birth. So it's not a hospital. We don't do C-sections. We don't do scheduled inductions or things like that. It is for low-risk women who desire to give birth outside of the hospital, and all the care is provided by midwives. So the midwifery model of care is the standard of care at the birth center. We want you to go into labor naturally. We want to do the least intervention possible for you to have a safe delivery. They do a lot of shared decision-making, shared responsibility. That is the norm and culture of a birthing center, which means that they do a lot of preventative care, a lot of education in the pregnancy and postpartum process.
And because these centers are new, I think there's always concerns about safety and that sort of thing, especially since there is a competing narrative out there that so getting as much education out there as possible. And I understand that the birthing centers only take the low risk pregnancies. Can you talk more about that in your safety protocols?
Correct. So the birth center is not necessarily for everyone, but it is for a lot of women. The majority of women are low risk during their pregnancy, meaning they don't have any substantial medical issues, like they don't have chronic hypertension, have diabetes requiring insulin. The majority of women don't have those medical problems. And so for those women, this is a safe option and a safe alternative. And it's actually recommended by the American College of Obstetricians and Gynecologists as one of the safest places to give birth in an accredited birthing center, which is what we have here in Birmingham. We are a nationally accredited birthing center.
And you're the only center in the state of Alabama that's operating presently, correct?
Well, we were, but Dr. Robinson in Huntsville, I believe they have begun their operations as of last month.
Okay. Okay, they have opened back up. We're gonna get, I'm gonna ask Allison Molson of ACLU to address there is an issue and a lawsuit surrounding birthing centers, but we're gonna ask Allison about that and just stick to Dr. Skanes for the medical and healthcare information. Dr. Skanes, you practice hospital-based deliveries prior to founding OASIS. So you have experience with hospital labor and delivery, birthing centers, midwifery models. So you have a broad range and a deep range of experience. What are your chief concerns about birthing care in Alabama today?
I think the biggest concerns, especially for Alabama, is that Alabama is very regimented. We're very set in our ways about a lot of things. And I think that we can't be that way when it comes to medicine. Medicine is a field in which there should be progression, meaning as you learn new evidence, as you learn new things, then the practice should change. And that's not what we've seen in a lot of the hospitals here in Alabama. We need to really start practicing evidence-based obstetrics and giving people more options, because some of the things that we were taught in the past are no longer true. We have studies that show these things are not applicable, and we continue to do them just because it's tradition. And that can be harmful to people. The second thing that I would be concerned about is that a lot of patients, I think the most common reason because they feel have not been listened to in the past. They feel like, I didn't get the information that I needed. I didn't know what my diagnosis was, or I didn't know how it would affect my pregnancy, or I didn't, I asked for these things and people ignored me. And so a lot of times people feel as though our hospital system is not serving the people, not serving in the best interest of the people, but rather serving in its own interests.
And I understand there is a new midwifery bill that's been filed, the midwifery expansion bill. I'm trying to figure out how we as women and allies can support innovative and positive changes like birthing centers with the midwifery model. Do you support the new bill? I think it's HB 312 that's in the Alabama legislature. Are you familiar with it? And are you in favor of expanded midwifery services?
My Zoom kind of froze a little bit, but I think that in this particular bill, from what I remember, this is basically changing like which midwives can work in the birth center, allowing them to do things that are actually within their scope of practice, not necessarily expanding the scope of what a midwife can do, but allowing them to do things that are actually within their scope of practice. And I think that, when it comes to supporting, birthing centers and really all of the causes that we're going to talk about today, I think the key to remember is that every single one of these reproductive health issues is intertwined and interrelated. You have to support all of them. You have to support women's ability to learn and make decisions for themselves, because if you start chipping away at the ability of women to make these decisions, the whole thing crumbles apart.
For sure. It's all about women's decision, private women's decision making. You are absolutely right. Thank you so much, and thanks for your innovation and leadership on this issue. It's amazing to think. I think midwives have only really been legally licensed to practice for about 5 years in Alabama. So, am I 4 or 5 years? So in a sense, that's a new model here.
Yeah, they re-legalized midwifery in 2017, and I think they gave out the first license sometime after that. But again, before 1970s, that was the norm here in Alabama. And so I keep reminding you of that because people will make you think that this is something new. It is not new. In fact, it is an improvement upon older practices. We have more information now, so we know who are better candidates to do these things.
You are right, and it is a women-led movement, and I trust women. Thank you so much.
Thank you.
Skanes. We're going to move to Janice with Yellowhammer Fund. Janice, are you on here?
Hi, I am.
Janice, I'm embarrassed. I don't know how to pronounce your last name. Is it Fountain or Fontaine?
Fountain, like water fountain.
Okay, great. I can do that. Janice is the executive director of Yellowhammer Fund, and let me tell you just a little bit about her. She is a grassroots organizer and advocate in Birmingham and is dedicated to reproductive justice, direct aid, and reparations for Black women and children. Denise is a mom herself, and she is the founder of Margins, Women Helping Black Women, a local community aid organization that addresses the reproductive, financial, and material needs of low-income Black mothers and their children. In 2024, she was named one of the women who shaped the state by the nonprofit This is Alabama. Denise, can you start by telling us about the Yellowhammer Fund, what you do, and who you serve?
Of course. Hi, everyone. I'm Janice, as Jennifer introduced. I started reproductive justice work as a single parent that was very much at my wits' end with the state and its services. I was navigating near homelessness, needing abortion access, needing financial assistance, and just really going up against what the state calls assistance. I was like heavily stigmatized. And it just wasn't useful. I was working like 50 hours and I couldn't get the services right. I worked too much to get the services, but the pay wasn't good enough to eat. So it was like that constant struggle of like, well, I'm doing what the state says you should do, right? You work and then you eat, but I was working and then not eating. And eventually, I was just like, actually, this doesn't work. Like Black women need something different. We need an avenue for resources that believe that we know what we need. So I found it Margins around the time where I was like literally navigating all the things, leaving DV and a lot of things. I came on to Yellowhammer Fund as a family justice organizer, just really bringing family justice work to abortion work, because I think what we don't acknowledge enough when we talk about abortion stigma is the why. And we need to have conversations about when we say, oh, people are like heavily stigmatized in Alabama, or like people have the stigma around abortion. It's not just that people are adverse to abortion, it's that abortion funds and abortion movements have largely been not good to Black and Brown communities. When we have conversations about what bodily autonomy means, it doesn't mean that you assess someone as like being poor or not smart enough to have a kid, and now you're like saying, oh, you deserve access to abortion. And what I find to be true when people say abortion is a popular issue, it absolutely is. Abortion should be available in my neighborhood. I want to be able to walk outside to a free abortion and figure it out. I want everyone to know how to manage their own care. And I want people to be able to keep pregnancies that they want. So I came on at Yellowhammer Fund, just really balancing out what it means to do reproductive justice work and what it means to do abortion access work in an autonomous way. So the fund started in about 2017 as a way to get clients to abortion care out of state that were like later term gestation. And eventually 2019 at the almost ban, I'm sorry, did someone say something? Sorry, someone's mic. At the 2019 ban, we had a bit of an influx, so we got to get staff, which was, nice to not do free work. I wasn't there yet, but they were doing free work. And so we staffed, and then we started getting people out of state still.
Just briefly, because I Zoom call right now.
Excuse me just a second. Can you please mute yourselves? Everybody please mute on the call if you're not speaking.
If you call me back maybe in about an hour, if that's okay.
Please mute. Shannon, is there anything you can do to help? I'm sorry, Janice. Let's try again.
Sorry, I'm trying to find out who it is.
It's Linda.
Oh, gotcha.
I said that so quickly. I'm such a shadow. It was Linda, but it was actually Linda.
Janice,
but around,
Gotcha.
Go ahead.
Around 2019, we had an influx of support. So we got to staff, and then our work became really assisting people that were also like earlier term. So we were getting people to care that were both early and late. What people don't realize about the current situation is that we're having these conversations like, oh, we have to get people out of state. We were already doing that. Alabama had so many regulations on what it meant to get care in the state that we were already taking people to Georgia and elsewhere. So our work just became a lot of the practical support. It was paying for abortions. It was transportation. It was making sure people weren't coming home to homelessness, which is something I noticed was true. We would have clients be like, oh, I got my service. I'm going back to sleeping in my car. Or I'm going to sleep in my car because, we have this regulation, or, it was a lot. So a lot of it was just the practical support around what does it mean to actually assist someone who needs care and not just get them to an abortion. Obviously, the Roe v. Wade decision, the Dobbs decision, meant that we had to pause And unlike other states, we had the threat of criminal conspiracy. So what we expected to be true was that we obviously can't do abortions in the state. No one can get to an abortion in the state. What we didn't realize is that the Attorney General would add the threat of criminal conspiracy, meaning that we can't even say like, hey, Dr. Skanes, you can just go to Illinois, ask this person this and get care without the threat of criminal conspiracy. And as that stands, it would be like 99 years if we were prosecuted for it. So like right after the Dobbs decision, our legal was like, don't mention abortion, don't say anything, don't advise, don't do anything. And we were like, fuck that. You got to come back with something else, or you're going to have to come get us out of prison, because that doesn't work, right? And when I say it's a death threat, I really do mean that. I've had people ask, like, don't you think that's a hyperbole to say that it's a death? It's absolutely not. Especially as somebody that is Black and birthing that needs abortion access. I don't look to pretend that I have the same stakes as everybody else seeking abortion. And I think largely what the movement has done has fixated on people that can get to care. So it's like, oh, we're just going to fund these people that can get people to care. We're going to assist people that can go out of state. And then everybody else is like, well, should have had that modicum of access so that you can get the assistance that you need. So a lot of our work has just been figuring out who's getting left out. It's often the same people, right? And then how do we assist them? Because the abortion access issue, it has so many things tied. There's like the way in which Alabama surveils its folks. And so like, we don't even want people to try to go out of state or manage their own without knowing like, okay, if I try to manage an abortion and have to go to the hospital, I need to say that I might be miscarrying, right? Like these little intricacies that people don't always have access to in terms of information has to be more accessible. So after the Dobbs decision, we got rid of our office, we got a bus. The bus looks like an ice cream truck. And so people are like, oh, ice cream. And then we're like, oh, we got plan B. And after a while, we kind of felt kind of guilty for having only plan B on the ice cream truck. So we got ice cream too, but we have conversations with people in person, because I think what we do well is just build a relationship, right? Like we're in a completely different landscape, or a worsening landscape at least. And what we have to do is build a relationship with people where they literally are. I've seen people use this so co-opted now that I'm hesitant to say meeting people where they are, but I do genuinely mean like we have to build a relationship with people where they are. And if all of our work exists online and all of our work exists in this way where you have to search it and you have to know where to look, we're not doing our work. So a lot of our work has just been like staying in community for years and building out these conversations. So when it's time to have that conversation about self-managing your abortion, or when it's time to have a conversation about legislation that centers abortion, people know we're not just seeing them as a means to like get someone else in a voting line, because that's not the work either. We have a legal fund because, is there a ruling yet for Judge Thompson out? No, there's not a ruling yet. We're actually like, it's any day now. So I'm reading the comments where it says, is there a ruling out for Judge Thompson? There's not. His son passed. So it kind of pushed it out a bit. But we're like any day now. It could be like this week, next week. Very, very exciting inducing, but also very exciting. So we have a legal fund now. And then one of our bigger programs is our fellowship. So we're like, the thing about Alabama for me is I think a lot of people have this obsession with like coming and being saviors. And I say that in the terms of like well-resourced people, white people, men, people in power. There's just assertion that we need people to swoop in, save us, tell us what the work needs to look like. When in actuality, we already have thought leaders, right? We already have people doing this work. We already have advocates. We already have Dr. Skanes talking about the Black maternal mortality rate and working at the intersection. So like, this is the same as true of us. We're a fund, we have resources. It's like, we have community members that are already trusted folks. Like, how do we arm them with everything? We don't need the whole Alabama to have to find Yellowhammer Fund. That's not conducive in this landscape. So we train 25 fellows a year that are community members to like self-manage their own care, to like know about maternal mortality, to know about maternal health in general. We had Dr. Yashika Robinson teach it last year, and Dr. Ghazala Moayedi this year. Hopefully Dr. Skanes next year, hint, hint. But, and feminism and sex ed and all those intersections, because we need places to come get information with people that aren't looking down at us, that aren't assuming that we don't have anything to offer a conversation. So a lot of the fellowship is a dialogue, and it's paid because we don't want people engaging and then like having to miss work or worry about, like, you're not listening to me on this call if you're hungry, right? You're thinking like, where am I getting my next meal? If your rent's not paid, you're not paying attention to me when I tell you how to get to abortion access. So a lot of our work is just like, what does it really mean to be autonomous in this work for abortion, for reproductive justice, for abortion access? What does it mean to really center the folks that we're claiming to care about? What does it mean to really disproportionately resource the folks that are disproportionately impacted? And then as a funder now that we've like post-ops, we're like, we should share some of this money. We've supported a lot of the work in the state, like the birthing centers, like chocolate milk mommies, because we know that like the divestment here is serious, y'all. Like people like, oh, y'all don't have an abortion clinic? We're gonna take our money somewhere else. Or people like, oh, Alabama's so backwards, so legislation is X, Y, and Z, and so now they don't deserve support. Or they think that you can't move legislation, so they don't support you. And the problem with that is, one, if you funded the work being done around civic engagement or policy in the state, they could move it. But also, even if they couldn't, people exist in the state that need services, right? And I've noticed a lot of the work in the state, people refuse to support Black-led work. The centers, like they don't. They're like, we know who's disproportionately impacted. They say it all day, and then they're like, let's give it to this person that I trust. And it's almost never us. So a lot of our work was just like sharing resource right after Dobbs and figuring out what that looked like and how to be in genuine community with people. And I probably talked for a long time, so I will pause.
It's amazing. I can see why you won the award for Women Who Shape the State. You're a dynamo. Thank you so much for filling this, and I hope you get good news on that legal decision. Allison's going to tell us a little more about that. But you are swimming upstream, and you are doing beautifully. In your organization too. 25 new fellows. I mean, just the thought of that kind of strength and that kind of power. It is encouraging on a tough issue. So thank you, Janice.
Thank you.
We're going to move on to Allison Molman, Legal Director of ACLU Alabama. I can see Allison on here. So let me tell you just a little bit about her. An award-winning, as an award-winning student, Allison earned a bachelor's degree in women's studies from the University of Iowa, and she earned her law degree from the University of California, Berkeley. She served as a staff attorney for the Equal Justice Initiative in Montgomery, Alabama, and then senior counsel at ACLU Alabama before becoming its legal director. Allison, go ahead and unmute yourself. And I know that you are currently assisting or tracking the 2 reproductive health lawsuits that ACLU is involved in, one with out-of-state travel for care and another on birthing centers. Can you, I think Shannon has put a link to these cases on your website, but can you bring both of the birthing centers affects, Dr. Skanes, and the out-of-state abortion care lawsuits affects Janice's work and all of these women. So can you bring us up to date on those 2 lawsuits?
Absolutely. Thank you all so much for having me. I just wanted to give a content warning before I give my comments. I'm deeply impacted personally by the laws in this state because of my own pregnancy journey. And I prefer to talk about that honestly, because I think sometimes when we talk about cases, when we talk about legal issues, sometimes we're divorcing it from like the actual facts of people's lives. And so I wanted to just say at the outset, I'm really grateful for y'all inviting me back. I was scheduled to be with y'all last April. And at that time, I had my 3rd miscarriage in a span of 2 years. And so it's been a really trying time for many of us in Alabama. It's been a trying time for myself and my own family. But doing this work is just so motivating. I worked for 10 years at the Equal Justice Initiative and did criminal defense work. And when Roe fell, one of the things that I recognized is that there were going to be criminal prosecutions of pregnant people, of their healthcare providers. And so I thought in doing more civil litigation, it might be helpful to have someone with criminal defense experience like myself. And so that's really why I came to the ACLU of Alabama. When we lost Roe, I knew that we needed more criminal defense lawyers doing this work, and that's why I came here. So in my first year at the ACLU of Alabama, we filed 2 big cases. The first case, Dr. Skanes is one of our plaintiffs, and we sued the Alabama Department of Public Health because of their de facto ban on birth centers. So one of the things that's been really frustrating in Alabama is that the Department of Public Health started to put out regulations, to put out rules, and they said that that would allow birth centers to open. But what we knew from our clients is that the bars that they were setting up for people that were opening these healthcare centers, that they were insurmountable. And so even though they were saying there was a path to getting licensed, a path to opening, we knew that that wasn't true. So we filed a lawsuit in the Montgomery County Circuit Court. We filed for a preliminary injunction. And fortunately, we won that preliminary injunction just about a year ago. Our trial was September of 2023. And with winning that preliminary injunction, the judge required the Department of Public Health to provide our clients with a temporary path to licensure while we're litigating this case more fully on the merits. And so Dr. Skanes was able to be the first one to get her birth center up and running. Dr. Robinson, another one of our plaintiffs, has been able to get that temporary license up in the Huntsville area. And so that case is still progressing. Even when you win at the preliminary injunction stage, a lot of times it feels like a big win, but you still have to get that permanent win. And so we're still fighting this case against the Department of Public Health, and we will do so until our clients can have the confidence that they're going to be able to provide the care for pregnant people in this state that they know is so necessary, and that they're already doing so effectively and safely. So if you follow the ACLU of Alabama, you can kind of keep up with how our litigation is going, but we'll be continuing this fight for our clients in the birthing centers context over the next year and probably beyond with how slow litigation moves.
And, I just think it's particularly ironic that when hospitals and labor and delivery units are closing and pregnant people have fewer options, that the Alabama Department of Public Health is not running out to birthing centers and Dr. Skanes and Dr. Robinson with open arms. I mean, these are positive and the best kinds of developments that we need. So it's really ironic and shocking that they would be over-regulating and essentially shutting these centers down. So anyways, just a little
Exactly. No, I mean,
editorial comment there, excuse me.
No, I think you're exactly right.
I mean,
there's hypocrisy and irony in all of this. For a state that claims to care so much about life and the right to life, we really don't do what we need to protect pregnant people and all the people that provide them care. So that's something that ACLU of Alabama is really committed to. And the other case, oh, sorry, go ahead, Jennifer.
You go ahead.
Okay. The other case that we've already briefly touched on, Janice highlighted that we should have a ruling soon from Judge Thompson in that case. But basically, there were 2 cases that were filed at the same time. So the Yellowhammer case was filed, and then we filed a case. The ACLU of Alabama and ACLU National filed a case on behalf of healthcare providers. So I saw Robbins on this call as well. So the West Alabama Women's Center is one of our clients in that case. And what we're hoping that Judge Thompson will find is that it violates the First Amendment rights of our clients, of healthcare providers, and right to travel for patients and their families when Alabama's Attorney General threatens to prosecute people for conspiracy for going out of state for legal abortion care. I don't think that Janice is being hyperbolic. It is this could be death. It's like a death sentence for people. If they get 99 years in prison, that is a life sentence. That is a death in prison sentence. And so it is just awful that our healthcare providers have been prevented from giving their patients the full breadth of options, the full amount of information about what their options are legally out of state because of Steve Marshall's threats. And we're really hopeful that it could, like Janice said, it could be any day now that we'll get a ruling from Myron Thompson finding that those threats are unconstitutional. I will add, though, these fights never stop at the first court. And so while we're very hopeful that we are going to get a favorable ruling in this case, we think the law is firmly on our side. It's very likely that that will be appealed at the 11th Circuit. And so all of that is to say, when you hear about wins in these cases, there's a lot of work that has to be done to protect those wins. And so we are engaged at every stage of the proceedings. And even when we get that win, hopefully at the district court in Alabama, we're going to be prepared to fight that and protect that win at the 11th Circuit. So I'll pause there. I could go on and on.
Yeah, well, I'm glad to know you're the legal director and you're on top of these cases, because I think you can handle the 11th Circuit. One question, I know you said you had a personal stake in reproductive health care restrictions in Alabama, and I think that did you want to address the problem that you had getting care for miscarriage?
Yeah. So I've been very vocal about this because I know that I have privilege and power and can be vocal about my experiences and not face the same level of retaliation that many other people in this state can when speaking publicly. So I'm a queer person. My partner and I have been trying to have a baby for about 3 years. I'm the person who's planning to carry our child. And we started trying to get pregnant right after the fall of Roe. And when that decision came down, I actually was like, I don't want to start yet. I'm really, really nervous about how this is going to play out in Alabama. So let's hold off. So January of 2022 is when we first started trying. Since then, I've had 3 miscarriages. In each of those miscarriages, I was not provided any supportive care because of Alabama's abortion ban. My first 2 miscarriages were blighted ovums, meaning that there was a gestational sac with nothing in that sac. There was no embryo, no baby, which I know we shouldn't use that term when talking about things, but these are the ways that like my doctors were talking to me. But basically I was sent home without pain medication and had to miscarry at home by myself. This most recent miscarriage I had that made me miss this panel in April, the ultrasound technician said, I think there's a heartbeat. I'm not sure, but I think there is. And because she thought there might be a heartbeat, my doctor wasn't comfortable with performing a D&C. And so that was another miscarriage that I was sent home and dealt with. And unfortunately, I didn't have, emergency health consequences related to my miscarriages, but the personal toll it's taken on both me and my partner to go through that 3 times, to go to emergency rooms and be told, maybe you're not as far along in your pregnancy as you think you are. Maybe it's just really early. I'm queer. I know when I got pregnant, so like that's not possible. But it's been a really, really difficult experience, and it gives me so much empathy and understanding for other pregnant people in the state that are dealing with this, and also for our healthcare providers. I always tell people I am not mad at my doctors when they can't provide me with these options. I don't blame them. I don't want any doctor to risk their career and everything they've done just to provide me the care I need. I blame our legislators. I blame Steve Marshall. I blame the politicians that have made a healthcare issue a political issue. So as I share my story, I always want to uplift the doctors and healthcare professionals that are doing the best they can. It is not their fault that they couldn't provide me that care in those 3 miscarriages. They were just doing the best they could under the guidance they've been given. So I appreciate you letting me share that, Jennifer. I think it's important to talk about how these issues impact us personally.
And I also just want to interject a national note. Or we woke up this morning reading headlines from ProPublica about a young mother in Georgia, Amber Nicole Thurman, who was denied a D&C because it is now a felony for doctors to perform a D&C in Georgia due to its abortion ban, and was denied a D&C when she was going into sepsis from in need of emergency pregnancy care. And this is something ProPublica has found out at the maternal review committee there in Georgia found out that at least 2 women's deaths that were denied D&Cs were preventable. And so this is just the tip of the iceberg. I think in our hearts, we've been knowing since 2020, since Roe fell, that this is happening, and we're just getting the facts out. So this is a traumatic situation for you, but also a potentially very dangerous situation. I have one more quick question. I know ACLU is not litigating the IVF situation in Alabama, but I'm sure you're monitoring it. I understand we know we have a shield law that temporarily protects IVF, but I understand there's still at least one legal challenge against it. Can you update us quickly on what your take is on where we are on legal stability for IVF?
Yeah, so the legislative fix that was put in place last session is not a fix that's going to keep IVF as an option in Alabama permanently. Like, much more has to be done. It's the ACLU of Alabama's position that the only way that we can truly get at this problem is the definition of personhood. That constitutional amendment that Alabama voters voted on before Roe had fallen, before we knew what the consequences of that vote would be. And so it's our position at the ACLU of Alabama that Alabama citizens should be able to have a revote on that. We should be able to bring this back to our constituents, to the people of Alabama, to say, this is our current landscape. Is this still how you want to define personhood in our Constitution? And it's our position that, as we've seen in other states, if we get this on the ballot, we can win. The challenge is getting it back on the ballot. So that's one piece. The second piece is that the providers, attorneys for the fertility clinics, for the labs that were sued, they have filed a cert petition at the United States Supreme Court. We're all friends here. I don't want that case to be taken up at the United States Supreme Court. I am not comfortable with the justices that we have on that bench, that they will do the right thing in this context. And so while we would love to see a court like undo the bad things that Alabama has done, me speaking personally, I don't think this is the case that's going to do that at the Supreme Court. I think we have much more to lose than to gain with these justices. So my hope is that we can dedicate our efforts and our time at the legislature and really getting that constitutional amendment back on the ballot so that citizens can have a revote.
And that was the provider that took that case to SCOTUS?
That's correct.
And just to clarify, we do not have a right to citizen-led ballot initiatives in Alabama, you know, in democracy or no democracy. We don't have that right here. So we, as I understand it, we have to convince lawmakers to pass a bill to put the repeal of this 2018 amendment on the ballot. So
that's right.
We got to get that through the legislature before it gets on the ballot.
That's
Thank
exactly
you
right.
so much, Allison.
Thank you, Jennifer. Thank you all.
Really informative. Okay, we're going to move on to Senator Linda Coleman Madison, one of our warriors in Montgomery. Senator Coleman Madison, are you on the call today?
Yes, I am here.
Okay, wonderful. I'm going to read just a little bit about you. Senator Linda Coleman Madison is serving her fourth term in the Senate, Alabama Senate, having served one term in the House of Representatives and 3 terms on the Birmingham City Council. Senator Coleman Madison has a bachelor's degree from Alabama A&M and a master's degree from UAB. During the IVF crisis this year, Senator Coleman Madison said that she had family members who had used IVF, and she argued for stronger protection and bodily autonomy. And we appreciate that. So we're interested in knowing, Senator, what are your thoughts on the IVF shield law today? And do you think some progress is going to be made on that in 2025?
Well, first of all, thank you for allowing me to participate in all of the other panels that are on. I'm learning from you. I think the IVF law that we passed was just atrocious. Quite frankly, as Allison has stated, it did essentially nothing but make matters worse and cloud the water even further, because people left there with no clear-cut method of where they go, especially women. As I stated in committee, what we did not address the elephant in the room, and that was defining an embryo as a person. It has opened up all kinds of cans of worms as far as if it is a child. Now, looking at in the future, any attorney, as I told Chief Justice Parker, any attorney worth their salt is going to have you for breakfast. They are going to be looking at, if it is a child, can I claim them on income tax? Can I get all the other benefits, tax credits and things like that that we are giving to families and children? So we need to go back. When I asked the chairman, why don't we just amend the law to take this out and accept the amendment that Representative Daniels had in the House, which all of the Republicans voted against. I'm hoping that we can bring this back, but as he said, we will fix it later. Later in their minds was after the November election. And that was key to them. They did not want this hanging over them. But as you can see, this is one of those issues that has taken the national stage. It has not gotten better. As a matter of fact, it has mushroomed to a whole issue that is impacting all women across the nation. And people in other countries are looking at not just Alabama, but the entire United States. This election is going to be key because it's going to be one of those things as to whether we are going to come closer to even reversing Roe v. Wade of this last decision that they made. So I am willing to work with you all in groups because we need to make sure that we have the proper wording to offer a bill that would reverse that decision. But right now, as I constantly get emails from women across the state of Alabama, and I was looking at one that a constituent sent me that said, close the health coverage gap to save moms' lives. And this was sent on the 27th of this month when she talked about the delivery department at Grove Hill Memorial Hospital is now closing its doors for labor and delivery. Many of these people in rural areas are having to travel great distances for the care. It is causing an expanded burden on urbanized areas because they are having to take in and those citizens that have to travel, again, as was mentioned, many of the procedures that they have, Alabama has denied. For instance, they talked about the DNC. And doctors, I really feel sorry for them because they are in a catch-22 situation. Trying to live up to their Hippocratic oath of do no harm, but at the same time, looking at our Attorney General who says that you will be prosecuted and you have no options because now he's trying to go after those people who choose to go out of state to receive. So this is an all-out war and attack on women as I look at it. And right now, our reproductive rights are certainly being used as a political football, and they are definitely on the ballot.
Senator Coleman Madison, thank you so much. We're going to have you back next year. I got most of what you said, but we are getting some distortion on your feed. So we want to be sure to get you back when when these issues are hot. But we are glad to know that we can count on you for expanding Medicaid and working to repeal that 2018 constitutional amendment, because that is that also touches the, if we're able to repeal that amendment, that touches the intersectionality of all of these issues that as Janice and Dr. Skanes pointed out, and Allison, that is so important. So thank you so much. We're going to move to Representative Neil Rafferty. I see Neil on the call. Let me tell you just a little about Representative Rafferty. He's a veteran of the U.S. Marine Corps and a native of Birmingham. He used his GI Bill benefits to earn degrees from UAB. served as program director of Birmingham AIDS Outreach before being elected to the Alabama House in 2018. He's been an outspoken advocate for women's health, minority health, LGBTQ and racial equity, veterans issues, and Medicaid expansion. Representative Rafferty was involved in helping to temporarily resolve the IVF crisis. He's also one of the co-sponsors of HB 279, a 2024 bill to protect contraception in Alabama. Representative Rafferty, I wanted to ask you, what were your thoughts on IVF right now in terms of the potential for a better resolution next year? And also why you felt the need to co-sponsor a bill on to protect contraception in Alabama.
First and foremost, I want to thank everybody who's spoken already today. Like the Senator Coleman Madison, I'm sitting here taking notes. Been really touched and appreciate your bravery and telling your stories as well, because that is way more impactful than you could ever realize. So thank you so much for your courage to do so. I collect myself here. So I think your first question, Jennifer, was regarding the IVF issue and where we are with that kind of in the legislature. Is that correct?
Mm-hmm.
Okay, so as everyone knows, we did go and provide criminal and civil immunity for all manufacturers of goods and services, as well as providers of IVF and fertility clinics here in the state of Alabama. I couldn't agree with Allison more that this is not the end of the issue. I do believe that, we already have another lawsuit that's coming up to challenge that one. And I think most of my colleagues know that as well. I think the biggest prerogative at the time when we were trying to get that through is just find the most streamlined way to get through to start making sure that these families that were in the midst of receiving these services were not further disrupted by the unintended consequences, I guess, by the Dobbs decision and the fallout here in Alabama when it came to applying the constitutional amendment from 2017 to 2018, I think it was. So essentially, we're not done with that issue. We know that it's going to come back up. We know that we haven't resolved it, and I do agree that the people of Alabama deserve the chance to vote on this issue again, particularly after understanding the ramifications of it to their neighbors' lives, people they know and love. Perhaps even their own families have had to deal with the consequences and fallout of that decision. So I think I don't know what that's going to look like. As Allison said, we do need to go back through the whole legislature, and not just the legislature. There's a higher threshold than there would be for passing a simple a budget bill, for instance, which isn't simple, but that's besides the point. Instead, we have to go forward, and there's a higher threshold where we have to get at least 3/5 of the votes of both houses in order to pass it, and then it would be on the ballot for the next election. I can say that there's a couple of political challenges with that. For one, I don't know if the Republicans want to support that and put it on the ballot. I don't think that there's very many that do. That's why I think keeping this in mind when the entire state government's up for re-election in 2026 is going to be vitally important, particularly in some of the places that might be a little bit more competitive. So be on the lookout for that. Make sure that you're just asking, questioning, drilling your legislatures and your representatives and senators on this issue, and making sure that they know where you stand and they know that they're going to face opposition you need to make it a not politically easy position for them to hold anymore, if that makes sense. It needs to be difficult, tricky.
We need a full court press.
Exactly.
And then I also asked you about contraception. Why you felt the need to co-sponsor a bill on contraception?
My biggest concern with contraception is that, as we've seen in the past, is before the Dobbs decision, even we saw bills being introduced that would ban any sort of contraception that might not allow a fertilized egg to implant into the uterus. So that means several long-acting, very effective birth controls that lots of people use to make their family planning decisions would be off the table and no longer accessible to Alabamians. It would just be another access. It would be another access point of of care for folks that would be taken away. And as I think Dr. Skanes was talking about earlier, kind of limiting the access is not what we need to do. We need to be increasing the access and the options for these people. So it's bothersome because, you know, a lot of my colleagues will be kind of be flippant, nonchalant about it, say, well, it's not really going to happen. You know, we're not going to move there. We're not going to go there. But I think honestly, where we're at a point where it's possible that the Supreme Court could come up, the Alabama Supreme Court, excuse me, could come up and then rule some of these things unconstitutional just because of that one amendment that's in our Constitution. So there's a lot of potential complications that could come out of the Dobbs decision and how our current Supreme Court in that state of Alabama is reading that decision and then reading, you know, it kicked it all back to the states as far as this goes. So all of these things didn't have to get reinterpreted and seen through the law that is the state of Alabama. All these things that were just political points for a lot of Republicans for a long time are no longer just political points. They're really affecting actual people's lives, and sometimes with deadly consequence.
For sure. So then that goes back to even the contraception issue goes back to repealing that 2018 quote sanctity of life or personhood amendment. Great.
Yes,
thank you, Representative Rafferty. We appreciate you being in the fight.
Yes, ma'am.
We're going to move on to Elizabeth Anderson, who is running for Congress in the 6th District. Elizabeth, congratulations on the amazing town hall that you had last night. With 3 or 4 reproductive health physicians and a lawyer who had a IVF journey. It was just really enlightening and encouraging, and to just know these women are in the fight too. Let me tell you a little bit about Elizabeth. She's a native of Childersburg, Alabama. She grew up living there below the poverty line. Her mother, the daughter of a single mother. Elizabeth understands the impacts of policy choices on everyday families. She graduated from the University of Alabama, studying music there on scholarships and grants, and went on to co-found her own technology company. From small town girl to mama to business owner, she says she knows how important it is for people in government to represent the needs of all Alabamians. So Elizabeth, can you tell us why, from what I can tell, you have made reproductive rights and reproductive health a top priority for your campaign. Can you tell us why that issue is so important to you?
Yeah, I want to kind of take a step back and talk a little bit about the very beginning and why this is so important to me, because you may not think, okay, why does she care about this? She works in tech, right? But all of these issues are so tied to my daily life. So when I was born, way back a long time ago, my mom had another baby before me. And the other baby that she had before me, unfortunately, passed away shortly after birth. He had a heart condition. He actually died in open heart surgery, and it was really tragic and awful, especially for my mom, who was a teenager and she lived below the poverty line, and she was, in an abusive relationship. So it was really difficult. So when it was time to have me, a couple years later, still a teenager, by the way, she did not feel like she had access to adequate health care close to her in Childersburg. So she did what any of us would do in that kind of situation when we were scared. And she drove over an hour to Birmingham by herself in active labor to have me. Wow. And so just from the very earliest stages, these kind of issues have impacted my life, but that was over 40 years ago, and that has really not changed, right? So today, right now, in rural areas across Alabama, like where I grew up, almost 90% of women live over 30 minutes from a birthing hospital. Drive times for people in labor can be up to 80 minutes long, very similar to what my mother went through. It is significantly worse for low-income women, Black women, Hispanic women in our community. These women have the highest rates of infant mortality, maternal mortality, preterm birth, low birth weight babies. It's really, really awful. So, you know, we've got all of that, but then we've also got this situation right now where between 2019 and 2020, we had a 24% decrease in the number of birthing hospitals in Alabama. You know, over 5,000 babies during that time were born in what's called a maternity care desert. And then, you know, we had the Dobbs decision, plus all of this going on, plus last year, right before I decided to run for office in Shelby County, where I live, we lost all of our maternity wards. So we do not have a single maternity ward now in Shelby County, which is one of our largest and wealthiest counties in Alabama. Meanwhile, 34% of Alabama counties are defined as maternity care deserts, so they don't have adequate access to care. So we've got all of that, the Dobbs decision, and, you know, I felt like I had to do something, right? So all of these things, to me, the maternal health care crisis, the inability to get care, abortion, IVF, contraceptives, all of these things in my mind are very interrelated to each other. And they're also related to poverty, because a lot of these bad health outcomes, or the inability to get care, the inability to have an abortion, these things lock people into poverty for extended periods of time, right? That's what we saw happening in my family over and over again. And I know that when we start regulating one of these issues, we are really regulating all of them. And a lot of our political leaders don't really understand the long-term impact of a lot of these policies that they're putting in place. And so my top priority is that I want to work towards a federal law that's going to enshrine the right to abortion, because I know for sure that it is going to save lives, right? So it's really important to me, but part of this reason why I chose to run for office is because my current representative, Gary Palmer, has run unopposed since 2018. And he's actually one of our most extremist politicians when it comes to reproductive rights. A lot of people are aware of his votes against abortion, but people don't necessarily realize that he votes against contraceptives, he votes against IVF, he votes against this every single time, and he's very quiet about it, right? So he's not out here, he's not a Marjorie Taylor Greene, he's not talking about it all day, every day, but he is very quietly working against us consistently over and over again. And so when I saw that, you know, he was about to run unopposed again, like once again, for the, you know, 6th year in a row, I just, you know, I could not sit by and let that go again. So I decided, look, so we got to at least have another name on the ballot, because this cannot fly.
Well, and we do have another name on the ballot, and it's you, and you are a terrific messenger for this particular issue. And important to note that Palmer is a co-sponsor of a national sanctity of life bill, life begins at fertilization bill. So that's a personhood. He would want a federal personhood bill.
Yes.
So all of the fallout that we are having over the loss of this spectrum of care in Alabama, he would vote to make national, as if to nationalize the kind of the chaos that we have in the healthcare system here. So Elizabeth, anything else on this issue that is top of mind for you that you want us to know about?
Yeah, we actually just had a great call last night. Jennifer mentioned it, where we had 3 OBGYNs, an infertility attorney. So she specializes in fertility law, which I thought was really interesting. And we were hoping to have a midwife on the call, but she wasn't able to join us because she was bringing someone into the world. So I was very, very glad to excuse her for that. That was a great reason to miss it. We should be putting out the recording on that pretty soon. And I would encourage folks to watch it, because we asked a ton of questions. It's 2 hours long, which seems very lengthy, but we really got to the heart of some of these issues, where we were talking about things, you know, at the end, we wrapped up with talking about, you know, can doctors tell the difference between an abortion, a self-managed abortion, and a miscarriage when you come into the hospital? And what is the legal ramifications of that? Like, what if they suspect you of having a self-managed abortion? What does that mean for all of our emergency care, right? That means that, you know, you're not going to get care. And we had this tragic case out of Georgia. We talked about that, how, you know, doctors are afraid to act right now, and how these things are so important and so tied together. And they really does save lives. So I would encourage folks to go and watch that video. Like I said, we'll be releasing that pretty soon. I also wanted to mention really briefly on Gary Palmer, because I think it is so important that we get him out of office. He does not just vote against, abortion. He votes against the Pregnant Workers Fairness Act. He voted against the Right to Contraception Act. He voted to defund Planned Parenthood. He voted against removing the deadline to ratify the ERA. He voted against the Family Violence Prevention and Services Improvement Act. He voted against the Pump Act for nursing mothers. And recently we had a constituent who wrote to him and asked him if he would support Tammy Duckworth's bill on the Right to IVF Act. And he compared it, he said no. And he compared assisted reproductive technologies to gene-edited designer babies.
Wow.
So we got to get him out of here. I saw
Yeah.
somebody in the comments that mentioned my necklace. I did want to show y'all this. So we created this for the campaign, and I can drop a link in the chat, but these are IUD necklaces. And we
Wonderful.
created these as sort of a symbol of our commitment to the right to choose, whether that is choosing an abortion or contraceptives or even abstinence only. Everyone should have the right to choose what's the best for them. But also as a symbol that if you see somebody wearing one of these, you will know that they have your back and they're standing for your rights. So this is a fundraiser for the campaign. So I'll make sure to drop that in the chat.
Thank you, Elizabeth. Thank you for being in the fight and for being so stylish about it. We appreciate you. On that note, before we've got one more speaker, Karen Barwick's going to talk to us about Project 2025. But Matt, I want to mention that Matt and Hive are holding a fundraising lunch for Elizabeth on Wednesday, October 9. Shannon will drop something in the chat about it. It's limited seating, but it's going to be a wonderful chance to get together and with some old friends at Sur West and talk more about issues like this and support Elizabeth and plan the goodbye party for Gary. So thank you so much. Our last speaker today is Karen Barwick. We have been talking about what's happening in Alabama today, and some people are arguing that have already argued that Alabama is a laboratory for Project 2025. But it's good for us to get a handle on the bigger picture. Karen Barwick is a citizen activist in Pell City who's been studying Project 2025 for about a year. Karen was born and raised in Birmingham, where she had a career working in insurance claims and as a litigation specialist in toxic tort litigation. And this work provided a path for her later interest in politics. And she's the co-chair of Democratic Women of East Alabama. She resides in Pell City now and serves as vice chair of the Talladega County Democratic Party and heads an online indivisible group. Karen, can you talk to us about Project? I'm be sure to unmute yourself and tell us about Project 2025 and with specifically looking at the chapter on health and human services to parse out what it would do, what kinds of changes it would create on reproductive health.
Sure. I hope everybody on here has at least become somewhat familiar with Project 2025. It is downloadable online. It is excruciating to read. So I've found a number of good sources of organizations who have been familiar with it, have read the entire thing and then written about it. But it is 900 pages long. It's the conservative policy agenda that spells out Trump's administration will decimate our fundamental rights and democracy, showing exactly how dire the threat of a second Trump presidency is. I'm going to read some of the items that have to do with reproductive rights, but and Jennifer found a really good link for anyone who actually wants to go directly to the page and find that language. And it's www.25and.me/topics.
Karen, I think Shannon is posting that link in the chat. We posted
good.
that link, a link to the original document, and then a link to your favorite tool, the one tool. So there are 3 or 4 links in the chat and the one that I like is the searchable link. You can search any chapter on a topic.
Okay, good. So I'll start. I've got 14 items that pertain to reproductive rights, and I'm going to read them. I don't have it committed to memory. Number 1 is replace evidence-based sex education in public schools with a focus on abstinence. Number 2, reverse the FDA approval of safe, effective mifepristone for abortion. It blocks access to both abortion pills and medical equipment used for abortion care, effectively banning abortion access nationwide. They want to revive use of the 1873 Comstock Act, prosecuting anyone who uses the U.S. mail or another delivery carrier to ship and receive mifepristone for use in abortion. Number 3, remove all Medicaid funding from Planned Parenthood and other healthcare facilities that also provide abortions. Number 4, withdraw Medicaid funding from states that require private health insurance funds to cover abortion and from states that do not allow healthcare providers to refuse to provide abortions or refer patients to abortion services. Number 5, ban emergency contraception, including ELA, which prevents pregnancy up to 5 days after unprotected sex. Number 6, they would seek additional legislative bans on abortion. This is one of the areas they might not state something outright. They go sort of through the back door in many of these things. Number 7, restrict your access to birth control. Proposes policies that would ban certain forms of birth control and emergency contraception. Promote the rhythm method and fertility awareness-based methods to prevent pregnancy, because that's worked so well in the past. Ban number 8, ban federal funding for travel to obtain an abortion. Number 9, refuse to protect IVF and other fertility treatments. Suggest that in vitro fertilization become fully obsolete and ethically unthinkable. Includes language that propagates the belief that life begins at conception. This so-called personhood language could ban not only abortion, but also assist fertility treatments like IVF. Number 10, restrict your access to emergency abortion care. Calls for the administration to allow hospitals to refrain from providing pregnant people the emergency abortion care they need. Calls for the Trump administration's Department of Justice to stop enforcing a federal law, that's the EMTALA law, that requires hospitals to provide emergency care to pregnant people who need an abortion. This would force countless more people to endure the tragic and life-threatening situations we've already heard so many horror stories about. Number 11, create a surveillance state to track your reproductive health. Suggests allowing the government to track births and abortions in pregnant people across the country. Suggests the government track and monitor pregnant individuals, including abortions. Argues that the U.S. Department of Health and Human Services, which is the chapter that mostly deals with all of the reproductive rights, argues that the U.S. Department of Health and Human Services use every available tool to ensure that every state reports exactly how many abortions take place within its borders, for what reason, the mother's state of residence, and by what method. Number 12, force conservative Christian ideals upon you to restrict your rights. Suggests weaving Christian nationalist ideals into foreign policy, restoring broad religious and moral exceptions to block abortion care and contraception. Number 13, enact investigations, regulations, and legislation that promote anti-abortion disinformation. Suggests publishing anti-abortion disinformation into federal health policy and deleting the word abortion from every federal rule, agency regulation, contract, grant, and piece of legislation that exists. Number 14, and last, is restrict the Affordable Care Act's Women's Preventive Services mandate and restore Trump-era religious and moral exceptions allowing employers to deny contraception coverage and eliminating emergency contraception. As a matter of fact, if Trump wins, he plans to abolish the Affordable Care Act, which importantly prevents health insurance carriers from refusing insurance to those with pre-existing conditions. Of course, the ramifications of these proposals and many others in all areas of our government will be devastating to us all.
Thank you, Karen. I think no, we do need to be informed. And this is I have read at least half of the chapter on Health and Human Services. And one of the amazing things about this whole attack on reproductive health is that it shifts a good many resources. I think it gives a one-line mention of maternal mortality and morbidity, and then shifts all of the thinking and all of the resources to the policing of women's reproductive health. So at the time that that we have the pregnancy police on our backs, we have no resources or thinking or policy going into the management of maternal mortality and morbidity, which we know will go up. So it's not just it's a multi-pronged, as the senator said, it's a multi-pronged war and attack on women's health care and rights. But anyways, the exciting thing about today is thank all of our speakers for being here, and thank all of you for hanging in there on this longer than normal panel. The exciting thing is that all of these folks are in the fight, and I'm feeling optimistic about this. We've kind of got our strategy from Representative Rafferty. Next in 2026, almost all offices, state offices in Alabama will be up for grabs. And we've got 2 years to organize and make our voices heard. One last thing, Matt and I have one more event this week. It's Thursday night. We're doing a postcarding for Congressional District 2, and we're going to hear Rebecca Rothman talk about Flip the Vote, which is a highly strategic way to raise money and spend money between now and November 5. In the swing states and in the places where you can get the most bang for your buck. So I think it's High Wire Brewing, starting I think 5:30 Thursday night. Shannon has it in the text. The chat. We recorded this. We will be sending you the recording, and we'll send you the links from the chat, and we will be in touch. This I think is our fourth Zoom on this topic, and we will be at this again. Thank you so much.